Schwannomas are benign tumors that classically affect the 7th and 8th cranial nerves, causing sensory neural hearing loss in adults. In this scene, I'll give you my visual mnemonic to help you remember the cause, symptoms, and treatment for schwannomas so you'll be ready for test day. You know what schwannomas makes me think of? That's right, swans. And this scene takes place on, what else? A swan boat. You know those swan-shaped tourist boats you always see on lakes? Well, they are all made right here by the best swan boat maker in the country. Anyways, the swan shape of this boat is here to help you remember both schwannomas and the cells they originate from, Schwann cells. Get it? A swan for Schwann cells and schwannomas? Recall how Schwann cells form myelin sheaths of peripheral nerves. Schwannomas are benign tumors of these myelin sheath cells, and they exert their effects by interfering with nerve signaling. Next, notice that our scene takes place at night. At Pixarize, nighttime is our symbol for adulthood. You know, since children are like the day, bright and full of energy, and adults are like the night that comes later because, well, you know. This scene happens at night, which should help you remember that schwannomas are typically seen in adults. Afterwards, take a look at our swan's neck. It's bent at an odd angle, right? Our swan's angled neck is here to symbolize the physical location of schwannomas, which are found at the cerebellopontine angle, also called the CPA. The cerebellopontine angle is located at the neck, and it literally describes the angle at which the cerebellum branches off from the pons and the rest of the brainstem. A few cranial nerves run through this angle, and the Schwann cells that form their myelin sheaths are classically implicated in schwannomas. Let's talk more about which cranial nerves are specifically affected. Yeah, the cranial nerves affected are represented on that gate there. Wait, gate? Doesn't gate rhyme with the number 8? Yeah, that's right. Cranial nerve 8, also known as the vestibulocochlear nerve, is classically affected in schwannoma. But what about those heavenly angels on that gate? Doesn't heaven make you think of the number 7? Because they rhyme. Duh. The 7th cranial nerve, also known as the facial nerve, is also affected in schwannoma. Now, I won't go into the anatomical functions of all these cranial nerves here. That's a video for another time. However, what's actually hard to remember is which nerves are affected. Well, I guess it's easy now. Just remember our heavenly gate to peg cranial nerves 7 and 8 to schwannoma. Now that we've gone through the pathophysiology associated with schwannomas, let's explore some of the clinical findings. Take a look at our expert swan boat maker here. It's a bit of a chilly night, and he's wearing a big pair of earmuffs to stay warm in the cold. By the way, these earmuffs should help you remember one of the classical signs of schwannomas, hearing loss. More specifically, schwannomas cause sensory neural hearing loss. This should make sense, especially since we just said that schwannomas can knock out the 8th cranial nerve, the vestibulocochlear nerve. Recall from anatomy that the vestibulocochlear nerve is responsible for transmitting sound and balance information from the inner ear to the brain. So if you knock out this nerve, you knock out hearing. It's not rocket science, folks. This finding of hearing loss is so classic that you may even encounter another name for schwannomas at the cerebellopontine angle: acoustic neuromas. Acoustic because they affect hearing, and neuromas because they come from nerve sheaths and affect the cranial nerves. Pretty simple, right? Let's pan next to focus on the boatmaker's daughter who's playing with her Nerf guns. Maybe she's pretending to hunt some swans by shooting at the swan boat. Kids do love their Nerf guns after all. By the way, notice how this girl has 2 Nerf guns in her hand. Coincidentally, her dual Nerf guns helps me remember that schwannomas are associated with neurofibromatosis type 2, or NF2. You know, 2 Nerf guns for NF2? NF2 is an autosomal dominant tumor syndrome that increases the risk of developing schwannomas. Patients classically present with bilateral acoustic schwannomas, which basically means that they have schwannomas affecting both sides. And as you can imagine, this knocks out hearing from both ears. Sounds like a lot less fun than this girl is having here. Next, let's briefly discuss how we can confirm a diagnosis of schwannoma. Notice the 100% waterproof seal mark. Of course you want your boat to be waterproof. You wouldn't want leaks, would you? This 100% waterproof seal is a great symbol for S100, which should help you remember that schwannoma cells are S100 positive. What is S100 anyways? Well, after you know you have an acoustic neuroma, a biopsy is sometimes taken of the tumor. Under the microscope, S100 is a stain used to identify Schwann cells. And since schwannomas come from Schwann cells, you can imagine how we can use the S100 stain to help us confirm a diagnosis of schwannomas. Related to the pathohistology of schwannomas is how our boat is half painted. You might say that this half-painted swan boat has two phases, a painted side and a non-painted one. This should help you remember that schwannomas appear biphasic on histology. What makes up these two phases? Let's find out. First, take a look at the spindle-like tie that is holding our boat on shore. This spindle should help you remember the finding of spindle cells. One of the phases you will see on biopsy is dense, hypercellular areas containing spindle cells. A spindle for spindle cells. Easy peasy. Next, notice the slimy algae covering the rope spindles. This slimy stuff is a bit mucousy, which reminds me of myxoid areas. And you guessed it, the other phase in schwannomas on biopsy is characterized by hypercellular myxoid areas. Myxoid refers to a connective tissue that is clear and mucus-like in appearance, just like slimy algae, right? So putting this together, biopsies of schwannomas are biphasic, with alternating hypercellular spindle cell regions with hypercellular myxoid areas. Just like this picture. Some pathologists even say it looks like zebra stripes. You might have to recognize this picture on test day for schwannoma, so I thought I'd include it. Finally, let's discuss how you treat a schwannoma. Like most other benign tumors, we treat schwannomas surgically by literally cutting them out. To help you remember this, just take a look at our old man's carving knife. Yeah, he's really digging into the wood to make this swan boat now. Just remember our man putting the knife to the swan to remember that we treat schwannomas surgically by resection. I mean, they call surgery going under the knife for a reason. Phew, that wraps up our scene on schwannomas. I hope you liked it. Let's do a quick recap. Schwannomas are benign tumors most commonly found in adults. They primarily affect cranial nerves 7 and 8 at the cerebellopontine angle. This can impact any function of the facial or vestibulocochlear nerves, but schwannomas most commonly cause sensory neural hearing loss. These tumors are associated with neurofibromatosis type 2, where they classically present bilaterally. Diagnosis typically involves a biopsy, and under the microscope, schwannomas stain positively for S100. They also have a biphasic appearance on histology, which refers to hypercellular areas containing spindle cells alternating with hypercellular myxoid areas. Surgical resection is the preferred method of treating schwannomas. Well, thanks for joining us. We hope you learned a lot about schwannomas. On to the next one.